This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google IV Panda Free Essays.
Subjective section. RA is a 16-year-old female with type 1 diabetes, first diagnosed 5 years ago. She is also obese and has hypothyroidism. She was binge drinking but quit 2 years ago upon being advised that alcohol could worsen her health condition. Unless when she has an emergency, she usually comes to the hospital for follow-up every month. Today, she has come for routine follow-up. Although she is asymptomatic, her blood pressure is 170 and 99 millimeters of mercury. She does not report any episodes or symptoms of hypoglycemia. She was using insulin but stopped 8 months ago after she improved her condition. Objective analysis. RA has a healthy appearance, and signs of acute distress do not characterize her. Upon being physically examined, it is shown that she has a height of 165 centimeters, a weight of 90 kilograms, and a pulse rate of 86 beats per minute. The physical examination also reveals that she has a blood pressure of 170 and 99 millimeters of mercury. She does not present with retinopathy or thyromegaly, the retina is healthy, and the thyroid glands are not inflamed. Also, she does not have diabetic foot ulcers, which are common in diabetic patients. Laboratory tests show that she has proteinuria, a cholesterol level of 230 milligrams per deciliter, normal TSH levels, HB level of 9.5%, creatinine level of 1.7 milligrams per deciliter, glucose level of 190 milligrams per deciliter, HDL and LDL of 134 and 35 milligrams per deciliter respectively. Also, laboratory results reveal that she has normal electrolytes. Assessment analysis. Related complications. These are complications that the patient presents. They are the following: hypertension, dyslipidemia. Nephropathy is confirmed by proteins in the blood. It is an indication that kidney nephrons are not functioning well to ultrafilter blood. Thus, excreted urine has traces of proteins. Risk factors. Risk factors could worsen type 1 diabetes in the patient. They are the following factors. Obesity is indicated by a body mass index, BMI, of greater than 25. Kidney malfunction, indicated by a high creatinine value of 1.7 milligrams per deciliter. Hypertension, readings are greater than 140 and 90 millimeters of mercury. Glycated hemoglobin / equals 5.7%. Therapeutic goals. Clinical efforts should focus on controlling glycemia to an glycated hemoglobin level of less than 7%. However, caution should be taken so that hypoglycemia cannot be caused in the process of controlling blood sugar. It should be a goal to prevent cardiovascular disease from occurring in the patient. This could be a serious complication. Reduce blood pressure to values lower than 130 and 80 millimeters of mercury. This is the recommended upper limit of blood pressure for diabetic patients. Cardiovascular disease risks should be reduced by encouraging the patient to feed on food that helps to maintain healthy cholesterol levels. The low-density lipoprotein, LDL, should not exceed 100 for healthy persons. Current medication. RA says that she is not on medications. A treatment should be initiated to lower glycated hemoglobin and help control symptoms associated with type 1 diabetes and other conditions. Other therapies may also be started to help prevent complications that are foreseeable in the near future. Plan. Further laboratory tests and workup. Tests to assess liver functions. Biochemical liver tests determine levels of biochemical compounds crucial in regulating normal physiological functions. Elevated biochemical levels in the liver would indicate that liver functions are altered. In order to confirm that the patient has hypertension, a blood pressure test would be repeated. If found to be expected, then the test will have to be conducted by many laboratories to determine the true values. CBC should be conducted so that infections can be ruled out or monitored. It is essential to rule out infections in the patient because they could lead to the worsening of her condition. Also, it is important to manage the infections with the right medications. More history is needed that will capture the following details. List of effective and failed medications. Detailed family history to establish whether any relatives have suffered from the same condition, type 1 diabetes, and the time of onset. Immunizations received in the past and their clinical implications. A review would be done to assess whether previous immunizations could have interfered with the patient's normal immune system. Trends of adhering to medications offered in the past and barriers that hindered the patient from adhering to the medications. The medical history will help to select the best therapies to provide and ways of addressing barriers that could make the patient not take medications as prescribed. Treatment recommendations. The diabetic patient will be put on insulin. In addition, she needs to adopt a healthy lifestyle that will involve feeding on a balanced diet characterized by significant amounts of carbohydrates. Also, body exercises will greatly help the patient to live a healthy life. Her blood pressure problem could be addressed by taking 10 mg of lisinopril daily. Monitoring. Insulin use requires routine monitoring of blood glucose levels. Carbohydrate and fat dietary intake should be monitored. Total fat dietary intake should not be greater than 7% of the total number of sources of calories. Health education. Educational approaches should aim to inform the patient about ways of using medications so that they could improve her condition. Also, she will be taught how to maintain a healthy lifestyle. Healthy lifestyle changes will involve a healthy diet and aerobic exercises like walking and running. Follow-up and referrals. Glycated hemoglobin should be routinely monitored for a period of 3 months. Hypertension should be assessed at every routine visit. LDL follow-up assessments could be done every 1 to 2 years. Referrals will be recommended when her conditions worsen. They would involve being referred to physicians or healthcare facilities dealing with specific health conditions. Cultural interventions. No cultural interventions are recommended for this patient. Nursing theorist. The care, core, and cure nursing theory would be used to offer care to diabetic patients. The nursing theory was formulated by Lydia Hall, who asserts that a patient should set his or her goals. If the patient in the case study sets her goals, then she will work toward achieving them, and her feelings and value system will influence her. Nursing theory would greatly impact the patient and improve her condition. Did you like this SOAP note, diabetes and hypothyroidism patient sample? To get more works like this one, make sure to check out the free database of academic paper examples at ivpanda.com. You will find thousands of samples for all your study needs, without even having to register.